right now. There's some warnings. The FDA did a study, or there was a study done that says it could cause some heart attacks. We're talking about Avandia.
Actually, it was a report that looked at a collection of studies that have been done over the last couple of years. And Avandia, another companion drug, is Actos. Basically, the report 2 days ago from the FDA said that there might be a 30 to 40% increased risk for heart attacks, strokes, or death from heart disease if you take Avandia.
And the FDA is actually kind of endorsing this report right now, saying you want to be careful with this drug.
The bottom line is be careful, talk to your doctor, but they're not saying stop taking it. They're not saying put a black label on it, which is a big warning sign that they put on drugs. Basically, they're going to be coming out with more information when they look at this data and try to confirm this data.
So I'm sitting at home. I take this drug, or I know a loved one that does. What do I do?
That's a very good question. First thing I tell my patients, and I've had 2 calls on this just in the last 24 hours. I know a lot of people are watching. Don't panic. The information that the FDA used can be very confusing. For all the studies they have that show it's a problem, there are also several good studies that show it doesn't cause heart problems. So the data is conflicting. Also, the way they reported it can sometimes be confusing by using different percentages and statistics. And thirdly, it's not a surprise to any of us who treat diabetics. Avandia has had problems, potential problems, for years. And that's exactly why Avandia is not the first choice or even the second choice, sometimes the third choice for treating diabetes. So if you're taking Avandia, it's probably a good reason.
All right, so maybe talk to your doctor, reevaluate
Definitely.
where you are, see if there's a new alternative you could take, possibly.
Exactly, or maybe relook at some of the other drugs that you tried before and couldn't tolerate, but don't stop taking it. Any diabetic who switches drugs has its own inherent risk. So just switching the drugs can be a problem.
All right, so we don't want to stop taking it. Maybe make a call to your doctor. Is there anything in the study that shows there's not a big reason for concern? Because you hear this warning and immediately you panic.
There were several. There were at least 2 or 3 large studies that looked at Avandia that showed that there was no increased risk for heart disease. With that said, what they reported was a collection of over 42 studies, most of them short. And when they put it all together, it showed there was a significant statistical increase for heart disease. So, right now it's conflicting data. What I would say is Avandia still shouldn't be a second or first choice for diabetes. It's still potentially a good drug for people who can't get control of their diabetes with other drugs. And if you're taking it, talk to your doctor. Make sure you wouldn't be better on something else. All
right. Lots of good advice. If you still have questions, call your doctor. Call Dr. Andy. You can give him a call at 239-694-6246 or drop him an email, draol@phc/md or -md.com. And this is on our website as well.